Hello, and welcome to our question of the week. This week's question relates to face-to-face and plan of care requirements. Can we address a couple questions to make sure we're interpreting the new rules correctly? I also want to go over operative note using it as face-to-face encounter. I also use a statement whenever the certifying physician is different from the face-to-face physician. I receive many referrals from inpatient physicians and want to verify if associates can also sign the plan of care when another associate performed the face-to-face. For example, a physician performed the face-to-face, but his associate, whom is the physician assistant, will be signing the plan of care. This week's question is answered by Healthcare Provider Solutions CEO, Melinda Gaboury. The answer is as follows. The only change to the face-to-face encounter rule is that any allowed practitioner can perform the encounter rather than only the certifying provider or directly referring facility. The certifying provider will need to certify the date of the compliant encounter in the certification statement. When an operative note is used as the face-to-face encounter, it must be accompanied by a pre-op note or post-op note to ensure that the condition being treated in home health is addressed, and also because the patient is unable to participate in a two-way face-to-face encounter when under anesthesia. An operative note alone will not be compliant since it does not meet the requirements. The certifying provider must include the date of the compliant face-to-face encounter as part of their certification statement. The face-to-face encounter may be performed by any qualifying practitioner and is not limited to the certifying practitioner or a practitioner from a facility admission. Be very clear that regardless of who provides the face-to-face, it must still meet all the requirements, within 90 days prior to the start of care or within 30 days after. It must be an actual visit note from the practitioner that is signed and dated. It must contain support for skilled need for home health and homebound status. It must also document treatment to the primary reason for the home health admission. Do you have a question for our clinical consultants? Join our HPS Alliance. For more information, visit healthcareprovidersolutions.com/HPS Alliance. Remember to like, share, and subscribe to our videos so that you don't miss future questions of the week, Monday Minutes with Melinda, and more.